Hello, I am Dr. Bhagyalakshmi, Senior Homeopathic General Physician at Ribha Homeopathy. I have clinics in Raman Nagar, Nagar, Bengaluru. I have been practicing from 22 years. Piles or hemorrhoids. What are piles? Piles are swollen veins in the lowest part of rectum and anus. Sometimes the walls of these blood vessels stretch so thin that the vein bulge and get irritated, especially when you poop. Piles are one of the most common causes of rectal pain and rectal bleeding. They are rarely dangerous. Symptoms of piles. Main, they will have pain, bleeding from anus, bleeding while sitting and while walking also will be there, and itching around the anus and constipation in some patients. Now I will tell about types of piles. There are 4 types of piles: external piles, internal piles, bleeding piles and blind piles. External piles are hemorrhoids or under the skin around the anus. External piles or external hemorrhoids are under the skin around anus. The symptoms of external hemorrhoids include pain, bleeding, itching and swelling. A blood clot can turn a hemorrhoid purple blue. This is called thrombosis. It can hurt, itch, bleed. When the clot dissolves, you may have a bit of skin left over which could get irritated. Internal hemorrhoids. In internal hemorrhoids, we cannot see swelling outside of the anus. Always will be inside of the anus, but whenever they pass stool, they will get outside from the anus. So then they will get pain, sometimes bleeding also will be there. Next type, bleeding piles. In bleeding piles, whenever they go to stool, that time they will get bleeding and pain also will be there. So in blind piles, they won't get bleeding while going stool or while sitting also, but pain will be severe. Swelling will be more, or some people will have small also. How can we diagnose piles? One is on physical examination. Doctor will look at your anus, rectum and to check for lumps, swelling, irritation or any other bleeding is there. According to that, we can diagnose. And one more diagnosis, digital rectal examination. Through that, we can diagnose. Now I will tell about diet. You must have more water and high fiber food you have. High fiber food means more vegetables, more fruits they must take. Continuous sitting should not be there. Treatment for piles in homeopathy. We have good remedies for piles. We give according to symptoms of patient. Somebody will have only pain, so for that pain we give. Somebody will have pain plus bleeding, then according to their symptoms we give remedies like hemamellus. If there is itching, we give sulfur, but these are all depends upon their symptoms.